Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. PCNA's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
So today we're grateful to be able to talk with Susan Halli Demeter about lipid management, and I'm going to let her introduce herself before we get into the content.
Hello, I'm Susan Halli Demeter. I'm a nurse practitioner that works at Mayo Clinic in Arizona, and I'm a clinical lipid specialist, and my focus in my practice is prevention, and I also manage hypercholesterolemia, problems with tolerating cholesterol-lowering meds, and focus basically on reducing future cardiovascular risk events in patients.
Well, you have a lot of great information to share with us today, and I know our audience is very excited to learn more. For those of you that aren't as familiar with the Preventive Cardiovascular Nurses Association, we actually started as the Lipid Nurse Task Force more than 25 years ago. So we have a long history of managing patients with lipids, preventing cardiovascular disease in lipid management, and have a lot of great resources that we'll probably touch on later. But we're so excited to have Susan here today to talk to us a little bit more. Today we're going to talk about the importance of screening and management of FH in efforts to prevent future cardiovascular events. So Susan, what can you tell us about that?
Yes, so you want to start, suspecting familial hypercholesterolemia, while you're taking a dedicated H&P with your patient. So, if you start to discover that they have a strong family history for premature cardiovascular disease or hypercholesterolemia, or you learn, that there's a parent or family member that, passed away very young, and that there was some suspicion of high cholesterol, and then you check their labs. And, if it's a pediatric patient, their LDL is at 160 or greater, you can have a suspicion for FH. And if it's an adult patient that you're seeing in the clinic, it could be an LDL of 190 or greater. And that's when you want to start asking more questions, maybe using a diagnostic criteria tool to assess and screen for FH, such as using the Dutch Lipid Clinic Network Diagnostic Criteria Score or the Simon-Broom criteria. And it's a point system. And then, based on the amount of points they carry, it may be something, if you're diagnosing that they may very likely have FH, refer to a genetic counselor for further assessment and screening. Yeah, and so, also you can also find clinical features on these patients as well, such as tendon xanthomas or xanthelasmas, corneal arcus. And if you start seeing those traits in the patients, along with the elevated LDL levels and strong family history, that may increase your suspicion, and then want to further evaluate and investigate and diagnose through genetic counseling.
So in this process of diagnosis, initially, are you as worried whether or not it's homozygous or heterozygous FH, or just that diagnosis of FH is the first step?
Yeah, typically, if you're seeing someone with homozygous FH, they're going to have markedly elevated LDL, like over 400 or greater. Or they could be a compound heterozygous that, especially the family history is what's so key is because they could have, father with high cholesterol, mother has high cholesterol. They could have different genetic mutations and then carry those traits to have a compounded, markedly elevated cholesterol with LDL sometimes 400 or greater. Heterozygotes tend not to have quite as elevated LDL levels. They're usually, at 190 or greater. Usually gathering the family history, it's usually one side of the family where this is coming from, and that it's a very helpful. The family history is a very helpful evaluation of all of this.
Do you find that most of the patients with whom you work have access to that family history, or are there often big gaps in the information that both you and the patient are seeking?
Yeah, a lot of times they'll know about their immediate family, but it can get a little more complicated when you're asking about siblings, especially if they don't talk to a sibling much, or they live far away, or they just don't discuss their health with them. Grandparents, sometimes they know, sometimes they don't, or aunts and uncles. A lot of times they know about the parents for sure. But, if you're seeing a patient and their cholesterol is so high, you have to start thinking about, do they have siblings? Do they have children? And, making sure that the cascade screening process starts if you do diagnose FH in these people.
Well, that is excellent information, Susan. We're going to take just a brief break, and we will be right back.
For more education, resources, and tools for your clinical practice, visit pcna.net. You'll find CE courses, patient handouts, and more, all free to access. Visit pcna.net.
And we're back with Susan Halli Demeter discussing lipid management. If you were listening to us just a moment ago, we were talking about FH screening and how important it is to get information from family members, to be aware of what those key triggers are that should make FH kind of pop into your mind in terms of a possible diagnosis. Obviously looking at those cholesterol levels. We're going to pivot just a little bit now and talk about triglycerides, another lipid component. So I'm hoping, Susan, that you can talk about the importance of treating elevated triglycerides, particularly when it comes to residual cardiovascular risk.
Yes, so a lot of times you may have their LDL pretty well controlled, but you'll see this residual high triglyceride level, and those triglycerides carry lipid-rich remnant particles, such as like very low-density LDL. And between that and having an elevated non-HDL, sometimes you'll check an apolipoprotein B level in those individuals, and it's elevated, and you need to intensify their regimen. Sometimes it's increasing their statin, if that's what they're taking at the time, which most of them are, or adding ezetimibe, or adding something like icosapent ethyl, because it did show a significant reduction in cardiovascular risk in trials.
So do you find that your patients are struggling to understand the difference between their LDL cholesterol, the triglycerides, and really questioning why they have to be on yet another medication for something that maybe in their mind seems like the same thing?
Sometimes you do have to sit down with them and explain what all the different lipid values mean. And then the other thing with triglycerides is there's other secondary causes for why they can be elevated. So maybe they have underlying type 2 diabetes that's not well controlled, and their triglycerides are residually elevated as a result of that. Or they have a thyroid disorder, or they're on an immunosuppressant, or some other medication that's raising their triglyceride levels. And so you have to kind of look at the whole picture and to see, is this something that's been persistently elevated? Sometimes it's weight gain, and especially if someone is more sedentary and you look at their weight trends over time and they're gradually increasing, you'll see oftentimes the triglycerides are increasing with that as well, and a lot of times the HDL is getting lower as well with that too.
So there definitely are a lot of factors when it comes to lipid management. Is there anything that you would like to add that we have neglected to talk about?
The importance of lifestyle. So yes, medicines can help reduce risk events, lower the numbers, but it's so important to encourage a heart-healthy lifestyle in our patients. Remember the Life Simple 7. Really, look at their diet if they need a referral to a dietitian to help with a lot of this, because sometimes just some dietary strategies can really help improve the numbers, and it not only helps improve the lipids, but it also helps improve their diabetes, their blood pressure, so many other things. Don't smoke, that's another factor. Alcohol in moderation or not at all if they don't drink. So, looking at that, making sure patients stay active, engage in regular physical activity as much as tolerated. If they can engage in 150 minutes a week, great. Not everyone can do that, but doing something is better than nothing. Another thing to reinforce with patients with hypertriglyceridemia is the importance of weight loss, in addition to the lifestyle piece, and that just losing 5 to 10% of their body weight can really impact their triglyceride levels and improve their lipid values overall.
Those are all great strategies for helping our patients be heart healthy and address things like lipids in their lives. Are there any resources that you would point our audience to if they have questions about lipid management? Any good resources that you might recommend?
Yeah, so a great resource for our patients with familial hypercholesterolemia is the Family Heart Foundation website. I refer all my patients there to get accurate information, just to learn more about their disease state. It also has a lot of great resources like letters that can be sent to family members to screen for FH. If they need to find a lipid specialist in their area, it has a map with lipid specialists that are available. There's blogs that patients can engage in to talk to others with similar condition and get feedback and just, exchange feelings they're having about their condition. There's also helpful resources with the prior authorization process, because a lot of the medications that are used to treat familial hypercholesterolemia require a prior authorization, and that process can be very challenging. The medications can get very expensive. So it just has a wealth of information. We also have a great resource as a tear sheet for our patients here on the PCNA website. So to go to our website and use that too, because it's a great resource.
Well, you have given us such great information about lipid management today. We're so grateful to you for sharing your time and expertise with us. Susan, thank you very much. This is your host, Geraldine Warfield, and we will see you soon.
Thank you for listening to Heart Nurses. We invite you to visit pcna.net for clinical resources, continuing education, and much more.